High-intensity light therapy. For every one person who has seasonal affective disorder, there's 4 people that have some noticeable change in mood when you don't get enough light. This is not just seasonal, however, it's also people that work the night shift, people that work indoors with no windows and stuff like that. I mean, there's multiple reasons you don't get enough light. And I just want to tell you, this is just, I think, interesting, this next bullet item here. In 1945, in a psychoanalytic journal, they had a case report of a man who presented each year, each winter, with severe depressions. And so they were trying, and this is long before I think anybody had a clue about seasonal affective disorder, but this was a psychoanalyst. His theory was that this man had developed a transference reaction. His feelings towards his mother were being projected onto Mother Nature. And every winter, she would abandon him by making all the leaves drop and it get cold outside. Okay. What if that's true? Okay. High-intensity light therapy. Doesn't matter how much hits your skin. In fact, you need to protect your skin so you don't get melanoma and that sort of thing. But the dose is 2,500 lux hitting the back of your retina. And in order to do that, you really have to have very bright light. And you can't get it inside. Like right now, even though I'm under these fluorescent lights, I probably have 600 lux hitting my retina. So it won't do it. So you do 2 things. Either get a light box like this lady. Where is she? Where's my lady? This is a 10,000 lux light, and so and this is a very popular brand that's used. And so you can sit within 3 feet of this and then do something like read a magazine or make phone calls or something, and there's enough light kind of bouncing off that you'll get 2,500 in your retina. Yeah?
What is it about the light? Is it the UV rays in the light? Or?
No, it's just bright light. And you know what? They've tried full spectrum light. They've tried fluorescent light bulb. It doesn't matter. Okay? But there is a pathway leading from the retina into the hypothalamus, and it's understandably called the retinal hypothalamic nerve. And so it has a significant effect on serotonin levels and also on the regulation of melatonin. And as you probably know, if you're totally dark, then your brain secretes more melatonin. So again, it doesn't have anything to do about hitting the skin and that sort of thing, but it's getting enough light to hit the back of your eye. You can go on a cloudy day, you can go outside without sunglasses and 10,000 lux. And you can walk around without sunglasses, and that's enough. Okay? So people can do this. In fact, there have been some studies, small studies, where they used light boxes versus just going outside, and there was really no difference. Okay? But the problem is, in the wintertime, it's cold. People don't want to go outside. So therefore, they may want to use a light box. Whoops, I'm going the wrong way. Sorry. The amount of time it takes to have clinical response, the dose, is 2,500 lux hitting the retina, and the dose is 20 minutes. But some people, 10 minutes a day, some people 2 hours a day. Huge variability. So you have to really do some experimenting with this one. Morning light is clearly more effective than later. But when people have depression that is largely due to decreased photic stimulation, okay, then you have rapid responses within 2 or 3 days. Okay? Now, it's not unusual that people have depressions that are more complicated. They're not just seasonal, and you may have to use antidepressants or other things like that. But if you have pure, seasonal affective disorder, oftentimes you get very quick responses. Okay? And then it says here, if you stop it or go to placebo, then you lose the effect. We already talked about the use of non-seasonal depression side effects. You can get this kind of problems. If you have eye diseases, probably, you obviously got to check with your ophthalmologist and make sure about that. Now, the theory is that it's the spectrum of light for blue light that activates this pathway. And yet the only research that shows that blue lights are effective have been done by the company that makes blue lights. And Norm Rosenthal at the NIMH is really the guy who discovered seasonal affective disorder. And to quote him, he says, "Forget it." Okay? So that won't be on your exam. All right. Yeah. Contraindications. Okay, the big problem, though, for us is bipolar. Yeah?
Would advising clients with bipolar disorder to wear sunglasses during the summer constantly, would that be at all useful?
Absolutely. And you know what? We won't get to it today, I'm sure, but you try with bipolar, you try to have stuff regularized 12 months out of the year. This has to do with the amount of exercise, the amount of sunlight exposure, the time of day that you go to sleep and wake up, the time of day you eat, you know, maintaining this extraordinary amount of regularity. And you do get much more depressions in the winter in bipolar and many more manias in the summer. So it's was there another question? Okay. Okay, let me talk about this and we'll take another short break. And then we'll have our last little bit of the day. Dawn simulation. Now this is really interesting, I think. Goes back to something I talked about in the last class, but you know, the humans evolved over a period of 5 million years at the equator, and the sun came up at the same time each day. And it's the only place on Earth that happens. You know, there's seasonal changes start moving away from the equator. And it turns out that the most potent environmental stimulus that regulates the circadian rhythm is the time of day that you get your first dose of light. Now, a lot of us can violate these things. We can cross a time zone. We'll feel some jet lag, but it's no big deal, you know. Or we can do shift work, and we don't, you know, you feel kind of crummy when you adjust into it, but eventually you adjust to it. We can sleep in one morning and get up early the next morning and all that kind of stuff, and it's no big deal. But people with mood disorders, especially bipolar, but also severe depression, you monkey around with the circadian rhythm, and it really throws a lot of things out of balance, okay? And so they call it maintaining circadian integrity. And the way to do this is to wake up at the same time each day and get your dose of light at the same time each day. Now, most people don't want to do this, but I'm going to tell you what, I've seen some patients where it's like we're doing everything, and they got maybe to second or third base, and you add dawn simulation, and sometimes they get a home run. Okay? So especially for bipolar, but for very hard to treat, treatment-resistant depression, this is a maneuver. And this does not require intense light, sunlight. Okay, it turns out that even a 100-watt light bulb next to your bed. But the key is getting some light stimulation and waking up at the same time. Now, everybody who's written about bipolar says you need to go to bed at the same time and wake up at the same time. The problem with that is sometimes people go to bed, but that doesn't mean you can go to sleep. But the truth is, no matter what, if you try hard enough, you can wake up at the same time each day. And again, a lot of people don't want to do this, but if your whole life is being devastated by bipolar disorder, then these lifestyle adjustments really do make a difference. Okay. And then this is just for fun here, sunlight exposure. Why do people like to sit in the sun? Melanocytes, I'll get to that in a second. Melanocytes, the cells in your skin that make you tan if you sit out in the sun, actually release little tiny amounts of endorphins. So you can actually kind of get high, you know, sitting out in the sun. Get melanoma, but, you know, have a good time while you're doing it. Okay, the flip side of this is most of us, we can do all kinds of things. We can throw all kinds of wrenches in the circadian clock, and we're okay. But, you know, people that have really severe mood disorders, you get the circadian rhythm out of whack, and it can destabilize people. Okay, let me see. I think that's exercising dose. Well, we'll do this, and then we'll take a break. This is interesting here. 1,000 steps a day has been considered in a couple of studies to be protective against depression in people that have had recurrent depressions. And so an easy way to do this is you get a pedometer and make yourself walk 10,000 steps a day. Now, you know what? The average American walks 6,000 steps a day. And so what this means, you don't have to be a jock to do this. I'm not talking about jogging. I mean, other kinds of exercise can be helpful as well. But simply moving a lot, and again, what did people do for 5 million years as hunter-gatherers? They moved. Okay? And 10,000 steps a day seems to be somewhat protective against depression. And then, and if you look at the literature on treating depression with exercise, this approach works 2 10-minute bouts of exercise a day, or 20 minutes 3 times a week. And all you have to do is huff and puff. It doesn't mean you got to be a jock. You don't have to sweat like crazy. You want to get a little bit of aerobic activity. And you can get this with a brisk walk. If somebody's not really fit, you find yourself a little bit, and that'll do the trick. And a lot of depressed people are not about to go to the gym 3 times a week, but they might be able to fit in 2 times of going out 10-minute walks.